Hello, this is Dr. Mary Grady, and I'm here to talk with you about, here it is, hoping, the flu, or a fancy way of saying it, influenza. Influenza, the flu, is a viral respiratory disease. You can see there all the things it's characterized by, and I would like to add that it's characterized by also headaches and malaise, which is a vague feeling of physical discomfort. I also want to point out that the flu can be mild and self-limiting, but if you're older, over the age of 50, or you're a child under 5, if you're a pregnant woman, or someone with a compromised immune system, or heart and lung problems, there is a high incidence of complications that come with this viral infection that you worry about. And you also worry with these real extreme groups and the compromised people of this having a mortality rate. And you hear of that in the news every year. People that have died from the flu. Epidemic, it's a widespread outbreak of the disease. That's what it usually is. Or it can be a pandemic, which is a global epidemic. So what is the pathophys of this thing called the flu? Well, the flu has a very short incubation period, and it also, I'd like to point out, weakens your immune system and increases the risk for secondary bacterial infections, especially in children. If they have the flu, their system is weakened. They have a respiratory infection. It could lead to an ear infection. So that's something to keep in mind as well. The other thing here on the pathophys is just let you know that something called Reye syndrome can occur. It's a neurological disease that typically follows a viral infection. Whenever you see something that's called a syndrome, that means it's affecting a lot of different parts of the body, a lot of body systems. It's more likely to affect children. And back in the late 70s, like around in the early 1980s, it was associated with the administration of aspirin products, especially in children. And that is where you saw the rule come out that children should only get acetaminophen and not aspirin because of that link to the Reye syndrome, to try to keep them safe. Other complications are there. How is it transmitted? It's transmitted by airborne droplets in direct contact. And there's 3 main types that they have identified. They've identified that it can be a type A, B, or C. Type A is the most common. It's responsible for most of the infections. And like type C is like the mildest, a mild respiratory infection. So let us keep on going here. The risk factors again, I think we've kind of covered those earlier when I mentioned all the things there. Infants, young children, people over 50, residents of long-term care facilities, because when you live in close contact with people, that is when diseases spread more. And healthcare providers. Healthcare providers need to be immunized, and because we are at risk for getting the flu because we take care of everybody that has the flu. So that brings us to the next slide with prevention. Vaccines are what is recommended. And I did a little study on vaccines because I was just curious. And what I found was vaccination against influenza started back in the 1930s. And it became really large scale in the U.S. by the 1945, in the 1940s. So they also have found that the vaccines, the World Health Department states, and also the Center for Disease Control, that people should get immunized yearly, especially all people over the age of 6 months, especially those that are high at risk and high risk groups, which we talked about on some of the risk factors. The vaccines are generally safe. Fever occurs maybe and 5 to 10% of maybe children who are vaccinated, and they might feel tired or have pain, muscle pains, but that is something to keep in mind. Just so you know, the vaccine contains a live egg protein, but they also make another version for people if they are allergic to eggs. Healthcare facilities in this area, the Cleveland area, are now pretty much 99% saying that all of their staff needs to be vaccinated against the flu. Whether you are allergic to eggs or not, you can get the other version. I talked to the Cleveland Clinic a few years ago, and they were telling me in all the Cleveland Clinic enterprise, there was probably only like a handful of people that were actually allergic to the flu vaccine. So they weren't having any part of that. They were making everyone get vaccinated. Also, some things to keep in mind is the vaccines come both in an inactive and a weakened form. That can be given based on the person and their needs. If you look there, there is a nasal spray as well as the immunization that can be given intramuscular. A lot of the data that's coming out now is saying that it's actually the injection has actually had better rates this past year, they were saying, than the nasal spray, which contains like a weakened form of the virus. So, there's some things to just kind of keep in mind about which one should be given to a person and when. There's some clinical manifestations here of having the flu that you can look at. And the flu symptoms are there, which we have talked about a little bit before. Signs and symptoms there. Big thing is fever could last up to a week. So sometimes if you have a person, especially a child, and their fever is still going on, just letting people know that that is common for a child for this to happen. The high-risk groups we talked about. I also want to point out that the flu vaccine, even though it's relatively safe and you don't see a lot of complications from the vaccine itself, I want to point out that when you sign the release form saying that you will get a flu vaccine, it says that you know that Guillain-Barré syndrome is a complication of vaccination. But the CDC in their most recent report states that all the studies that they've done on the recent influenza vaccines, they have seen no link with the flu vaccine and Guillain-Barré, but you will still see that listed. Guillain-Barré, like I said, it's like a very, very small amount of people that would get that type of neurological disease that could be. It can go from being a very mild form to being one that's a little more severe. Sometimes Guillain-Barré will resolve itself and sometimes it does not. So those are all things to kind of keep in mind as well. If someone has the flu, we will run a bunch of tests on you because that's just what we do in medicine. And when we run all these tests on you, a lot of them are just to rule out all the things that it is not. Because when you present with flu symptoms, they are kind of vague and they could look like something else. So you'll see like chest x-rays done just to rule out pneumonia. You may see a white blood cell count done just to rule out anything that's bacterial going on in the body. We do know the flu is viral. We're going to have to give antivirals. Antibiotics are not going to help us. Also, another thing down here is to get a nasal throat swab because that way we can test for the influenza virus. So what is the pharmacological therapy? Antiviral again, like I said before. And what they do is an antiviral prevents the release of the virus from the surface of the infected cell and inhibits the replication of the virus. That's just something to keep in mind to know how it's working. It stops the replication. Tamiflu is the most common thing that we give, and it's given orally. And a couple other things to point out, we're giving analgesics here, but we're not giving aspirin to children, okay? Bed rest, good fluid intake, and good hygiene is important. Hygiene interventions is like proper disposal of tissue and good hand washing. We really want to emphasize this adequate fluid intake because we want to prevent dehydration. Yearly vaccines, like we've said before, is very, very important. And education about how to prevent the flu by getting the flu vaccine, washing your hands, and covering your mouth when you cough. These are all things your mom have told you to do, and that's what you need to do to prevent the flu. When assessing an ill patient, you would want to assess that patient and get all the information you can as well about when did you have the vaccine last, what meds you're on, your conditions, your exposure, so that we can promote and educate how to get well as how to prevent. Nursing diagnosis that you probably don't even think about when you have the flu, because some of you guys, when you have the flu, that's the last thing you're thinking about is nursing diagnosis. But when you have it and you think about it, you have ineffective airway clearance. You have ineffective breathing pattern. You're at risk for those secondary infections. Remember, like kids getting the flu could get an ear infection later on. Someone with COPD, it could lead to pneumonia. You have disturbed sleep patterns. You're not sleeping good. You're fatigued. And it's basically community health and the different people that you're exposing. Oops. What did I just do? I think I'm going all over the place here. I think I did go all over the place. So what are we going to do to treat this? Okay. What we're going to do to treat this is we're going to treat the temperature, keep it within normal limits, maintain good fluid balance so the patient does not get dehydrated. Because if I'm not maintaining good fluid balance and my temperature is up and I have a fever, I am at risk for dehydration. Oxygen saturation within acceptable limits and maintaining a patient's airway. Sometimes with the very young, maintaining that airway, especially with infants, might mean using a bulb syringe to clean out the nose so that the child can breathe. Because with tiny little airways, it doesn't take very much to plug those up so that you can't breathe. Some tips are there. Some things I would like to point out is a bedside humidifier is always good to cause the secretions to not be as thick. Another thing is keeping the head of the bed up and having the person have rest so that shallow breathings doesn't happen as much, because when you breathe real shallow, you're at risk for atelectasis, which is the alveoli in the lungs start to collapse, which is going to make you more at risk for pneumonias and other things. So antipyretics, analgesics, preventing infection. This is a key thing I would look at. I would know standard precautions. I know you got to wash your hands, tissues, disposing of them properly. This is droplet precaution is how this is spread. And keep a distance of at least 3 feet from other people. That is one of the ways that you can prevent the spread of influenza. I just want you to remember that if you see OTC in any of these PowerPoints, it's over-the-counter medication. And that concludes our little video on influenza. Thank you very much, and I will be taping more. Bye.